Hi, everybody. My name is Hanjo Kim, and I'm a spine surgeon at the Hospital for Special Surgery, professor of orthopedic surgery, and spine fellowship director. I'm excited to do the case highlights for today. Here are my disclosures, none of which are relevant except that I am on the physician advisory board for Aspen Medical Products, and I am talking about a brace that is manufactured by Aspen Medical Products. So this case highlight is really around the concept of PJK mitigation. And as we know, PJK has a multifactorial etiology, and therefore the solution for it is really a multifactorial approach. And as we know, the incidence of PJK is very high, about up to 40% in some studies. But I think the most disheartening thing about PJK is that if we look at studies that have been done comparing strategies for prevention over the last 10 years, the incidence has not really fallen. And I think perhaps one way that we could try to prevent PJK is to utilize all methods for prevention, because most studies that have been done in the past have just maybe looked at one or two strategies, and therefore alone have not provided efficacy in preventing PJK. So the reason why we got interested in this is because I was interested in bracing as sort of an adjunct and an additive for my PJK prevention sort of cone of prevention. And the reason why this made sense to me from a theoretical perspective is that, for example, in this schematic, if you were to have screws that were placed up to T10, for example, or even up to T4, you could see that this sort of a hyperextension type brace could prevent the flexion moment that would happen that could exacerbate the incidence of PJK. So this is the new PJK Align orthosis that was designed. And you can see that there's some significant improvements to the design compared to a traditional, for example, hyperextension Jewett brace. Some of these things are very important to prevent some of the issues that I saw utilizing the three-point Jewett brace. And you could say that here, you could see the TLSO sort of design of this brace utilizes some of the patented technology that Aspen provides with the lumbar corset that provides added security for the patients, and also some designs on the posterior portion that I think are going to be very useful for utilizing in this subset of patients. And then, of course, an easy way to don off and off the brace for ease of patient compliance. Also, the brace is reimbursable through an L0464 code, which could be useful for patients, for physicians who are utilizing DME in their practices. We also, after the brace was designed, we wanted to evaluate the efficacy of this in preventing the flexion moment. And so we utilized the brace in a normal subset of patients and subjects and evaluated the biomechanics through their flexion moment from sitting to standing and going through some of these activities that our patients are going through every day. So you could see here the new brace design is actually even better than the traditional Jewett style three-point brace. Sitting thoracic flexion moment goes down compared to no brace significantly with the brace, but then the new Align brace is even better than the traditional brace. And then the standing thoracic flexion motion really also improved on the thoracic flexion motion as well. So I think the mechanical portion of the brace is actually superior to older style braces with the provided benefits of all the things that I mentioned for this subset of patients that need it. The bracing protocol that I currently utilized is have patients fitted preoperatively, roughly, for over their waist especially. And a lot of them require big realignment operations. So we do some fine tuning and readjustment in the post-op supine position on post-op day 1. I advise the patients to wear it at all times except when they're out of bed. And so basically when they're walking, when they're standing, and if they're taking short bathroom trips, for example, in their homes, they don't necessarily have to put it on for that. And then at 6 weeks post-op, that's when I actually see the patient's back. I make sure their wound is healing appropriately. I will start them on physical therapy at that time. And I keep them on the brace for an additional 6 to 12 weeks afterwards if they decide to start physical therapy. If they do not start physical therapy, I let them come off of the brace. And at that time, basically, I considered them to be discharged from the brace. Here's a case example of a 58-year-old patient who presented to me with these x-rays, significant amount of leg pain on the left side. And you can see here long-standing thoracolumbar deformity in addition to a lumbar curve and elements of degeneration here. She had some element of osteopenia, so I basically focused on trying to give her a good alignment, center her skull over her pelvis, and then use some supplemental bone strengthening with vertebral augmentation to allow for better fixation across my upper fixation points. In the acute postoperative setting, you can see here she already started to develop some signs of junctional kyphosis. And so I put her in a hyperextension type brace. And you can see here that there was an immediate improvement just by placing the brace, sort of like a postural training tool for these patients. And you can see here, even at the 6-month follow-up, that correction is somewhat sustained. I would say that before I was using the brace, the likelihood of this patient needing a revision surgery and me having to extend them up proximally to the upper thoracic spine is probably higher. But now that there's an element of education and postural training that happens with these patients that I think allows us to prevent that from happening. And that's also why I think in our retrospective study, we saw a lower incidence of junctional kyphosis in the brace patients, because it's not just improving the angle per se, which was marginal, but it was also improving their overall posture to optimize their sagittal balance and to allow them to sustain the correction and to prevent the progression of the junctional kyphosis. Here's another case of a patient that I used the PJK align brace for, similar type of deformity. And you can see that this patient presented with significant left and right leg pain. Right-sided leg pain was secondary to the lumbar curve here, nerve compression at L2-3 and 3-4, and sagittal plane, some thoracolumbar deformity as well. I realigned this patient with a similar T10 to pelvis type operation, did not use any sort of bone augmentation towards the proximal end of the construct. And you can see here, no evidence of PJK, and really a totally different way of walking for this patient with a totally redefined posture as well. But I think the utility of the brace is not only in those patients that undergo thoracolumbar stopping points for the upper instrumental vertebra, but you could also utilize it for patients that have upper thoracic vertebral body stopping points, because the upper chest pad really sits at the manubrium. So going even for stopping points at T2 or T1, I believe that it could definitely be useful for. Here's another case that had another case of a patient with a PJK align brace that was placed. These are 1-year follow-up images demonstrated good alignment, no evidence of junctional kyphosis at this point. And I believe it's likely due to a combination of not only the alignment and all the prevention strategies that we utilize, but also the postural training that brace allows for the patients to sort of develop. And some of the muscle memory, I think, takes about 3 to 6 months for patients to sort of develop. And I think that doing physical therapy with the brace helps patients get acclimated to that as well. Here's another case of a patient with a similar type of deformity, upper thoracic stopping point, but you can see here good alignment at the junctional level. This patient is slightly shorter, 6 months post-op, but really no signs of junctional kyphosis that's developing at this point. So in conclusion, I think the bracing strategy that I present to you here in this case highlight for the PJK Aspen Align brace could be a useful adjunct for PJK prevention. It's a non-invasive strategy for prevention, really easy to put the brace on and off, provides patients with an added level of security, and perhaps allows them to start physical therapy a lot more sooner in the recovery process, and hopefully will allow them to, one, prevent PJK and allow their recovery kinematics to be improved as well. Thank you very much.